Good evening. Are you all having fun? It's amazing. When we started, we thought we'll be having about 10 people. This hall capacity is 100 and we filled it up. Okay. See, this program, when we counted, there were 81 fellows, past and present, going through this cardiac program. And 52 showed up today. What it reflects is we all have such a sweet memories of the program. We all have great respect for you mentors. Thank you. We fellows, we are the host of this party. We invited our mentors and 30 other guests who have helped us in all the different ways. As fellows, as a host, we welcome you all and also thank you for accepting our invitation. We do miss Grace and Otto in this party, but I'm glad Elena is here to represent Otto and Armando is here to represent Grace. Both of them were very special. You know, Otto was loving every fellow. He had nicknames for everybody. Yes. He used to call me Ramacharaka. I have no idea why he got the name Ramacharaka. Even Gelman had nicknames from some people. He used to keep calling me Jason. Now I realize, he was actually calling me Jay, my son. Grace, she is a wonderful person, as her name stands for. She was always very gracious. Okay. We miss them all, but I'm glad you two are here to represent. As for our fellows, it's very nice of you. So many of you could come very far. Vikas came all the way from India. Irma came from Ecuador. They were all from outside the country. Bolivia, I'm sorry, Irma. I'm a little bit wrong today. It's very nice of you to come in spite of your very busy schedule. It speaks how much you love this program. Okay. Ming and I, we keep hearing, oh, thank you for organizing this party. But truly, we are the ones we want to thank all our fellows. You all responded so enthusiastically the moment I floated this idea. And on top of that, many of you donated so generously to sponsor all our guests. Very nice of you, thank you. I won't take too much of your time. It's a busy evening, there are a lot of speakers. I'm going to give the mic to Jocelyn. Where's Jocelyn? Jocelyn is our MC. She is very hilarious. Yesterday I asked her, hey Jocelyn, how can I help you? Oh, just get me some vodka. Jocelyn, she must have had taken already some vodka, right?
No, I'm sober.
You are driving, the bar is closed, I can't give you any more.
I know, and that's bad.
Here is Jocelyn. She's she graduated in 2003. She's practicing in South Florida. Here is Jocelyn.
Hello, everybody. Thanks for the opportunity of being here tonight. I really don't know why I'm here. I'm not really funny, I don't know. Some of my friends have told me that probably I'm the one that has the least to lose of the whole group, so I can go with my life after I finish this tonight. Basically, yes, as Dr. Chandler mentioned, I was from the class of 2003. And like all of you, I share a lot of memories of the wonderful years that we spent at Jackson Memorial Hospital. Obviously, we are here tonight to honor the greatest of the greatest, all the teachers and all the people that shared those wonderful moments with us. And I would like, before we start the program of the night, to offer 1 minute of silence for Dr. Grace Wolf and Dr. Otto Garcia, that even though they're not here tonight, they will always live in our hearts.
And also Dr. Robert Pierce and Dr. Karen Singh, both good fellows who passed away.
Let's all do that tonight, and Grace, please, for 1 minute. Thank you. Thank you very much. The first speaker of the night is going to be Dr. Arthur Pickoff, obviously the fellow with the best hair in all the pictures. That was amazing. That was a great hairdo. I really admire you. Well, it looks so nice. He was really hot. Let me say a little bit about Dr. Pickoff. I never met him in person until tonight, until I asked him to tell me how to pronounce the place where he's working, and he gave me great help. Let me just say that he started his internship and residency in Mount Sinai Hospital in New York in 1975. After that, he did his fellowship in Pediatric Cardiology at the University of Miami School of Medicine. After that, a cardiac electrophysiology fellowship, and he remained as a faculty of the Department of Pediatrics, Radiology, and Pediatric Cardiology at University of Miami for a while. Exactly, I'll tell you in a second. That was until 1987. From 1999 to 2014, he served as the chair and professor of the Department of Pediatrics of Moonshot School of Medicine in Rice State University in Dayton, Ohio. From 2015 to the present time, he is a professor emeritus of Rice State University, again in Moonshot, the School of Medicine in Ohio. Dr. Pickoff is an avid researcher, and he has been involved in many grants and research projects funded by the American Heart Association and the NIH. And I will introduce you to Dr. Pickoff.
Wow. There was a point in time there during that video, I don't know if I was going to be able to get up here and do this. I gotta be honest, okay? But I'm going to give it a try, okay? I'm going to give it a college try. So, first of all, thank you for asking me to speak. The reason they asked me to speak is because they said I was the first fellow. Wrong. Okay? So I'm going to hand over the microphone to Lenore Zies. Thank you very much. You know, I'm walking around today, and you can overhear conversations. Look at him. He's got none. Look at her. She's coloring hair. Look at him. And when you go up to somebody, they look at your name tag because they don't know who the hell you are. Okay? All right? So we all change over time. Okay? Over 28 years, we change. I think we changed really well. This whole group. I think we're terrific. Everybody changed except Ann Lynn. Ann Lynn did not change. Okay? That's all there is to that one. Okay. Oh, okay. Who's doing that? You're doing that? Okay. I said, wow, this is pretty cool. Again, thank the organizers for getting us together. How wonderful. And I may have left somebody out, and that's not by intention. So Ming gets with me, like in October, he says, I think we want to get a reunion together in 3 weeks. I said, what are you, nuts? Are you out of your mind? Okay, so the other possible date is February 6th, or whatever today is. I said, that works, okay? That works just fine. So I think we made a good choice. Okay. We're here for two purposes: honor our mentors and honor the retirement of some of the folks in the room, and just to have a fellowship reunion. So I'd like to begin by saying to Heinz, Dolores, Peter, Grace, and Otto, thank you for giving us our careers. Thank you. As was mentioned previously, the reason we are all here from all over the country and all parts of the world is because of how we feel about this program, the love, the respect, that this was some of the finest times of our lives, being here and trading with these people. Okay? Don't take that for granted. I know of a couple of programs across the country where if you were to try to do the same thing, you would need TSA security agents at your door. Okay? And I won't tell you what those programs are at the podium, but if you come up to me later, there are some. Okay? They train you very well, but it's an environment you don't want to be in. Okay? So really appreciate the environment that you created for us. So Heinz, Dolores, Peter, enjoy your retirement. Okay, you well deserved, and make the best of it. And don't worry about the farm, it'll be fine, okay, Peter? And you know, while we're here talking about our mentors and our teachers, anybody who wasn't attending in this program, I'm going to ask to rise, whether in surgery. Dr. Perryman's here somewhere, I know. So if you were an attending physician in this program, please rise and be recognized. Say a little word about each of you, okay? So, no, I can't. I know you said say whatever you want to say, but I can't. I just can't do it. But you are the boss. Bruce Springsteen is not the boss. You are the boss. You set the culture, you set the tone, you made it what it is, okay? And that's why we all flew in from all over the world to be with you tonight. I remember trying to find him when he was making rounds on the wards. It wasn't hard. Okay? If you went to, what was it, 3 East, 3, I forgot what the name of the place, to whatever West Ward, and if everybody was standing there going, oh my God, that was amazing. Oh, so he's been here already. Yeah, he's been here already. So it was not hard to do. I remember one time I came out of the cath lab, I was in scrubs, and he wanted to go somewhere, we needed to make rounds. I said, let me change. Oh, let me change first. He ripped they were paper scrubs, okay? He ripped them off of me right in the middle of the hall of the cardiology. Do you remember that? Okay. And I'm sitting there like this, okay? And Nothing to hide. I have nothing to hide. And that's you. But, no stronger advocate of patient care. We did whatever we wanted, research, teaching, whatever, have fun, but when it came to patient care, absolutely uncompromising. Okay? And you can tell people when you speak about private parts. Okay? I'm not going to do it. Okay? You know what I'm talking about. Okay. Where's Dolores? Dolores, where are you?
Over here.
Oh, okay. Hey. I cannot even imagine a more patient, kind, gentle, competent, wonderful teacher as Dolores Tamer. In the cath lab, oh my God, she taught me everything, indicator, dilution, curves, everything. And she was always just the way she is right now. Even when I stuck a needle through a glove into her hand, it was okay. It was okay. No yelling, no screaming. Even when I overdosed a kid with procainamide 10 times the normal dose, it's okay. Let's get levels, she said. So, just delightful. And just so you know, Dolores came here in 1967. She was the first associate of something I'm going to talk about a little bit later, Dr. Frank Hernandez. Peter, or Pedro to me, I'm sorry. Who remembers that? 2 great arteries and AV valves were identified. The great vessels were normally related. And you know, for some of the younger folks, when I started, there was no such thing as 2D and Doppler echo. This stuff happened while we were there. And we got these machines, and we pulled kids from all over the ward down onto the floors, into the echo room, and echoed them and learned about these new techniques, and it was transformational. But even though, because of you, we are all pretty darn competent in echocardiography, okay? What you taught us, and I heard this from more than one of the fellows, was no, don't put the transducer down. Examine the child carefully. And you taught us all how to do that. And I took that with me throughout my career, and I'm sure the rest of you did as well. And when I was asked why, I always say, because one day you're going to do an echo, and it's going to show something, and you got to be able to say, no, there's more here. There's more here than that. There's something else wrong. And you were the one who taught us that. So thank you so much. What to say. It's been said already. This lady is an angel, was an angel. We loved her so much. And she was the one who brought clinical pediatric electrophysiology to Miami, and she was a complete joy to work with. She was fun. Does anybody remember an ice skating trip we took with her? Okay. So she was delightful. She is missed, and it's been said already, but her impact on this program was tremendous. She was one of the sweetest and most wonderful persons I have ever met in my life, Armando, and it's wonderful to see you here. You bet, you bet. Okay? And in 1970, this guy was recruited into cardiology. He was somewhere in Jackson Hospital doing something, Heinz, maybe you can... Pathology. And I think it was Eduardo Bancalari who recognized that this was actually a great anatomic pathologist and Mary Jane Jesse. Okay, that is correct. And Otto, working with Otto was an experience unlike anything you have ever known. So you are trying to put the catheter in the right place. He gives you about 14 nanoseconds to get it done. And then he doesn't say, let me show you. Boom, body slam. And he does it, and you just laugh. You just crack up. One day I came into work with very nice blue jeans, okay, really cool. I look good. And when he came up to me, he said, Arturo, I used to wear those in jail. Okay? Expressing his complete disapproval of that, okay? And after catheterization, when we put the films up, we were looking at them, I would say, Dr. Garcia, do you think that's a coarctation or not? It was not clear. And he would say, you've heard this, I know you've heard this. Could be yes, could be no, could be anyhow. And that's what he said. And then we'd go out to lunch, we'd go for Cuban food. He'd try to get me to love this bacalao stuff, which I still don't like. But I'm glad you're here. Next slide. Jerry Kaiser, what a delightful person. A great, great surgeon. I remember being in the cath lab once, I don't know, by myself or one of you. Femoral vein torn, we're just sweating, we're pumping blood. Let's call the surgeon. Jerry comes in. We can't control this. Jerry comes in. No, you see the Dolphin game yesterday? and within 2 seconds, the bleeding's controlled, the vessel's repaired. It was wonderful. There's somebody else here I want to show you because I couldn't find a picture of her, and I didn't realize that it was in this picture. But Mary Jane Jesse was one of the directors of Pediatric Cardiology here. She was from Columbia Presbyterian. That's a big connection to the University of Miami Cardiology program. She was director of the Heart, Lung, Blood Institute, president of the American Heart Association, responsible for the recruitment of Otto Garcia, Pedro Ferrer.
That was the first Love Dog Club heart meeting, the post-op meetings we had with patients with Jerry organized.
So a very important person. And as mentioned, he's no longer with us, and 2 fellows who are no longer with us, Bob Pierce, who trained with you guys, and then came to us at Tulane, and Sharon Jeet Singh. Pierce, you did a good job with him. He was great in the cath lab. He was spectacular, okay? And Sharon Jeet Singh, I remember we were going to a scientific meeting once, and I was sharing a room with him, and he was going to take his turban off, okay? And there were a lot of people wondering what that was going to be like, wasn't it? And he was delightful. He taught us pharmacology, pharmacokinetics. He was a gentle, wonderful man. Next slide, please. Okay, I want to talk about lineage a little bit, because particularly for the younger people in the audience, I want you to know where you came from. So musicians like to do this. So this is Frédéric Chopin, taught this one, taught that one, okay? I took lessons in Dayton, Ohio. I'm supposedly a descendant of Franz Liszt, although he would turn over. It's not very pretty. So I want to talk a little bit about the people who taught your mentors, because that came down to each and every one of you, whether you understand that or like that or not. So, for example, where's my slide guy?
The slide guy.
Hey! That's pretty cool. I guess it's time for the 5-minute break.
No, I like that.
Okay. So, there we go. Okay. Heinz, I wrote to you. I asked you who was the director of cardiology when you were a fellow. Sidney Blumenthal. I could not find a picture of him. Welton Gersony, director of the cath lab. This is part of the huge Columbia Presbyterian influence on the University of Miami program, and so the clinical training came from these folks and were instilled in him, and then he passed it down to you. So you have been influenced by these folks. But, next slide. I think maybe equally important was the influence of Brian Hoffman, pharmacologist, cardiac electrophysiologist. I spent a year at least with him, 2 years, and this was part of the beginning of electrophysiology tradition and background at the University of Miami. This was profound. You were well known for bringing electrophysiology, pharmacology to the University of Miami. So this was, I think, a huge influence. Next slide. Dolores. These are people you guys talked about, so if I'm wrong, I'm wrong, but Bill Rashkin, okay, that was your guy, I think. And I don't know if you know this, but Dolores performed the first balloon septostomy in Miami in 1970, okay? It made the newspapers, it was dramatic, and he was a cool guy. He was an interesting guy. We were at a meeting once, American Heart Association. He turned around and looked at me, somebody was presenting something. He goes, "This is bullshit." So crusty, interesting guy. Next, I think I got this right, Peter. I know you went to the University of Chile, you have training, but Boston Children's, right? You spent some time there. And there was a tremendous, 3 years, okay, transformational influence on Peter. He always told us about the folks there on Prague and everybody, and Grace as well, Armando. Highly. So all of you in this room are influenced and have been, in a sense, taught by the people of Columbia Presbyterian, Boston Children's Hospital of Philadelphia. Next. Then there's the Cuban influence, okay? This is a little harder for me to sort out, but I think I've got it. Most in the room probably don't know Augustin Castellanos, okay? Let me tell you how famous this guy was. He did the first angiocardiograms in the Western Hemisphere. He was nominated twice for the Nobel Prize in Medicine, okay? And he had there's a picture of his hands in the textbook of angiocardiogy, and they're bent from the radiation that he exposed his hands to, okay? But he directly influenced Francisco Hernandez, who was the first pediatric cardiologist in the state of Florida. Frank came back here in 1945, and he worked at the National Children's Cardiac Center, which was on Lejeune Road. He took care of kids with rheumatic fever. Eventually, in 1964, this relocated to the University of Miami. Because of his ties with Augustin Castellanos, they built a cath lab, state-of-the-art cath lab in Miami, and I'm told that south of Johns Hopkins, there was nothing else that could compare to what was at the University of Miami cardiac catheterization laboratory. So, just amazing. And by the way, the electrophysiology tradition and heritage of the University of Miami, yeah, Brian Hoffman, and yes, everybody, but this guy invented a catheter, electrode catheter with a hemodynamic tip to diagnose Epstein's anomaly of the tricuspid valve. It was published in 1958, I believe, and 68, okay, 56, and transformational, and we used that. We did that a couple of times in the cath lab. So the electrode tells you you're in the ventricle, but the pressure tracing tells you you're in the atrium, so you've just diagnosed Epstein's anomaly of the tricuspid valve. He told me stories of him flying airplanes from Cuba to Miami. He said, the storms, and you have to look at your instruments, because if you don't trust your instruments, your head tells you something else, and you go into the ocean. Okay? And Eloina, at least this is what Otto said, that when Frank was in his last days, hospice, and thinking that he was dying, Otto would go into his room, look at him and go, no, not today, no. So whether that really happened or not, I have a feeling it did happen, okay? Okay? And next slide. This is the Children's Hospital in Havana, where Dr. Castellanos, okay, the Nobel Prize nominee, and Oda Garcia worked and developed the science of angiocardiography, catheterization in children. This is their cath lab, and you guys don't know what this is, but that's the Van Slyke method of doing oxygen content. So after the heart catheterization, you would have to spend hours and hours measuring oxygen content. You just didn't do an O2 sat in 2 seconds, okay? So this is really the origin of pediatric cardiac catheterization, angiocardiography in the Western Hemisphere, or maybe the world. Next slide. And here's a picture of Dr. Castellanos doing a heart cath in Cuba on a little neonate. Is that oh no? Eloina, do you know? Is that? Not sure? Okay, next slide. This is the hospital today. Okay, so needs a little repair there, but that's your origins, that's your heritage, and I want you to know about it. So, very, very strong influence of these wonderful folks, wonderful physician scientists from Cuba. Next slide. Discovery. One day he comes to me, "Dick off, it's not all about listening to a stethoscope. I want you to go in the lab." I go, "Well, why would you want to do that?" So I went into the lab reluctantly, And there was a little piece of neonatal atrial tissue in a bath. Because I read all his stuff. It was Purkinje fiber, ventricular muscle. I said, okay, we'll do the atrium. Okay, we'll do the atrium. And I lowered the electrode in, recorded this action potential in 1980, and the world changed. It lit up for me. I understood what he meant when he said there's more to this than just listening to a stethoscope. So I asked the postdoc in the room there, Alan Ezrin, I said, so where did this neonatal tissue come from? Where did this rabbit tissue come from? He goes, it came from Studley. And I didn't know. I thought this was like an animal supply company in Miami. I go, Studley? What's Studley? He goes, follow me. So we go down in the basement. This rabbit cages. He opens a cage. He goes, this is Studley. I went, uh-oh. And then he opened another cage, put Studley in there, and boom, 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 boom. Okay? That's where these neonatal samples came from. And shortly thereafter, I couldn't hack that. I couldn't handle that image. We learned, and many of you in this room worked with us on this model. We learned how to place electrode catheters in the atrium, ventricle, and his fundal region of little neonatal animals, little 600, 800 gram animals. And a lot of folks here did that with us. And this resulted in, I don't know, dozens and dozens of papers, and it was just a transformational event in my life and many of yours as well. Next slide. But we had other kinds of fun, clinical fun. Anybody know who this baby is? This is a baby. I know the baby's name. I guess you can't say it now. So, huh? You don't know? This was a baby with severe persistent fetal circulation. And the neonatologist, the kid was dying. Okay? So I said, this is very simplistic. I said, here's what we're going to do. We're going to put blood pressure cuffs on each extremity because persistent fetal circulation is elevated pulmonary vascular resistance compared to systemic. So I said, we're going to elevate the systemic vascular resistance. So we blew up these blood pressure cuffs sequentially above arterial pressure, and holy moly, the sats went 50, 60, 70, 80, 85. I went, wow. Okay. Neonatology attendant comes in, what the is going on here? What the heck are you doing? I said, well, I'm just trying to help here. Don't be angry, you know. So I said, is this really working? I said, yeah, let me deflate a cuff. Okay. The O2 sats go down. And this kid eventually went home. So that was clinical fun. Now, I'm going to venture to say that apart from myself, Juris, Lenore Zeiss, and maybe one other, nobody has had the experience of the fellows of taking an unstable cyanotic child to the cath lab. You all put them on prostaglandin, they were toasty and nice for the next morning, okay? But we were one of the sites to investigate the use of prostaglandin E1 in the cyanotic infant. And I remember being in the cath lab with Odo, 2 in the morning, kid saturations of 40 or 50, gave prostaglandin, and the saturations, 80, 85. He looked at me, and he said, "Call Gordo." Believe it or not, this is the fat one, Gordo. I dialed the number. He gives it to Gordo. Your child is improved. Saturation 85. Also learned a little bit about human subject protection and informed consent because we were doing these studies, but all the others were like out cold from anesthesia giving birth. So we would do the study and then get consent the next day. That's not exactly right. You can't do that. You can't do that anymore. Next slide. Next slide. The joy of discovery, the research. Me. Reverse alternating winky buck, whatever that is, rose and blue. Where is he? What were you smoking? Where is me? Get him in here. If you have ever tried to read these papers, okay, you must not have had a glass of wine in the past month. Okay, you must be very, very well rested. They're brilliant, and there were many, many other papers like this that he and Grace wrote, because in those days we measured intervals and carefully looked at intracardiac electrograms. Next slide. Giroux. Did you ever in the cath lab with George Giroux? You're trying to get across the aortic valve and you can't do it. He goes, I know, Art. I know what we can do. We take a wire and run it to the ceiling, get it to a pulley, put it on a little motor, run the motor, it'll go right in. Okay? So that's how George Giroux thought. And one day he invented this device to keep children, neonates, in the cath lab warm. And it worked. And it didn't interfere with their physiology or the angiography. It was just incredible. They wouldn't let me use it at Tulane. When we went to Tulane, they said, "You're not using this thing." Giroux invented it. So. Next slide. Echo. Oh, here. The Echo papers that came out of the University of Miami. Because of the innovation and everything that we did were transformational and seminal. And there's so many of them. I just put a few of them up there just for fun to look at. Next slide. And there were some first evers coming out of this program. And I'm going to highlight just two of them. And again, I'm talking from my era. I know there were some many wonderful things that happened, in the late 90s and the 2000s, and I just don't know about them, okay? Cardiomyopathy and the use of implanted cardiodefibrillators in children. Where's Sharon? That's yours, okay? And that was the first one ever published in children. And Pat, I see you here, right? Okay, LV dysfunction in children with HIV, with AIDS. This is an abstract, okay, but it is the most widely quoted abstract I've ever seen in my life. It was one of the first reports of LV dysfunction in children with HIV. Next slide. Thank you. You want to talk about first ever? Where's Meta? All right. Asha. Okay. Summary of a Pediatric Dysrhythmia Conference in Miami, Florida, November 16th, 1980. A discussion of premature ventricular contractions and ventricular tachycardia. For this purpose, the first of anticipated annual meetings took place in Miami in November 1980. This was the birth of the Pediatric Electrophysiology Society. That's the program you all came from. You ought to be all extremely proud. So, the joy of the program, the joy of being a fellow in the Pediatric Cardiology program at the University of Miami. A round of applause for all of you and your back.
Thank you, Dr. Pickup, from Boonshot. I wanted to let our mentors know that we're here to recognize your hard work and your endless dedication to all of us and to your patients. It takes an extraordinary human being to touch so many lives and leave such a remarkable legacy. I would like to call at this time to Dr. Dolores Tamer, Dr. Peter Ferrer, and Dr. Henry Galvin for a few words.
I was applauded that much upon my honeymoon.
I'm sorry, Dr. Cavender, I had to say one. Just one. I'm not going to just say a few words, and I don't really care if it runs over or not, since I'm one of this distinguished guests. It took me till 2 o'clock in the morning after Jay's dinner last night, and this is a very humbling experience for me, at least. And I really appreciate it wholeheartedly. I'm really moved. And I'm not very emotional about things, but when Jay and me came up with this, I never thought this would happen. This turned out, these words. Thank you very much. Now let's get down to business. I'm not going to thank Ming and Jay again, because everyone's done it over and over again. But where's my waiter? I think what we're missing is we've got to also thank two other people, and I want Janty to come on up here, and Sue. You know, they had to put up with an awful lot over the last 3 months, I guess. Oh yeah, well you had... That's for you. It's always put a little behind good men. For those that missed dinner last night, you missed a good meal. I'm sure the brunch is going to be just as good. Sue was also the financier, kept track of everything, so thank you. If there was any success to our program, and if I could be humble enough to say I think I was part of some of it, as outlined by the author, it's because I tried to surround myself with people who were smarter than me, and people who were willing to work as hard as me. And it made my job relatively easy, and I was fortunate. There's two, Otto, Grace. Grace was my mother's superior. Every time I moved a little bit too much to the right, she'd tap me on the shoulder and say, Otto, well, what can I say about Otto? Best pediatrician I ever met, the most humble man I ever met, the best pediatric cardiologist I ever met. And we don't forget those things, but enough of that. I also don't think this is just for the faculty. This is also for you fellows. I don't know if you know what you've really accomplished, but we always had an open door relationship with our fellows, entire faculty. And what you accomplished as a group over the 40 years, and if I first have to apologize because I know what the fellows have done very well for the first 25, 30 years that I was director, and I really didn't keep up with their fellows since the year 2000. So I apologize to you for not sewing well, but let me give you a few examples. In the first 25 years of the fellowship, you fellows were part of 3 chapters that were published, 1 monograph. You published 34 original articles in Circulation Research, American Heart Journal, etc., and 46 abstracts. That's something that all we did as faculty was open the door for you. You went through it, and you people did it. Now, my style, I pushed a few of you. Where's Macro? He did the pushing. But you saw what you people have done, as was presented by Drs. Coley, Fournier, and everybody else. Who's number 3? Fred. And who? I tried to forget him already. Leave me alone. You keep reminding me. As I said in the past, and a few other people, there was not one day that I ever regretted getting up in the morning and coming to work until I left pediatric cardiology. And the last 10 years were tough. But I think that the way the day started is unusual. I would come in at 7:30. I would see Vivian. Where's Vivian? It was like mention your names. You got to stand up. Vivian Hickson had put up with me for over 20 years as my quote secretary, administrator, anything else you want to call her. She basically ran the division. You also got to remember that historically, 1973. When we came down from Columbia, a bunch of us, and we had a training program there. I said, my God, we need a training program. So I conned Jackson to give me 1 fellow a year for 3 years. Then we went to 2 fellows. Then we got a training grant in electrophysiology. We had another additional 2 fellows. So we grew annually, and you gave us as much as we gave you. Teaching you was easy. You didn't know anything in pediatric cardiology. I mean, you know, there's a few of you still don't, right, Marco? That's what you get for sitting next to the camera. Where do we get to her? But anyway, We had the first, 1974, we got approved for the program from Jackson, and Lenore Zeese became our first faculty, quote, fellowship interaction. She had been at Jackson for a couple years before that, so she sort of knew what she was getting into, but not totally. Let me tell you what these people did. Pickoff you heard of, and there's many accolades that go for him. He was hired after his fellowship, and he basically started our pharmacodynamic program in the lab. And many of your publications, which I will get to in a minute, actually originated with his mentorship. It was just, again, he was good enough to continue the tradition of training fellows the way they should be. If you look at what you really accomplished, Dr. Zeese, 73, 74, 75, first person to indicate the use of indomethacin in the pre-metaclosa ductus is basically gestational dependent. I don't even know if she remembers this, working with Jeannie McCarthy. No one else in the country, they don't just give indomethacin PDA, but the older neonates didn't respond. If I miss anybody, please let me know. Meta, first one to show atrial fibrillation flutter in patients with WPW. Today's a scary thing in the adults, scary thing in kids too, but he was the first one to systemic, who are you? Ashok, stand up. Where you hiding? I don't know if he probably doesn't remember this either, but he's the first one in the country to show that this phenomenon exists in kids. Singh, he basically spent 6 years in Minnesota but wanted to do electrophysiology. But we were smart enough to say, no, you can do electropharmacology. That started a whole trend, as Arthur indicated. Paper after paper. We were using propafenone. We were using amiodarone. I'm talking about 1982, 83, 84, in the immature animal. And manuscript after manuscript came out. Costa, first one to look at multiple AV nodal pathways. Young, well, Arthur put it up, but what you really want to read is the Rosenbluth hypothesis paper. I bet you there's not a fellow here that remembers what the Rosenbluth hypothesis of the AV node is. Who knows what it is? Come on, fellows, especially since 1985. Does anyone know what it is? Don't feel bad, because after I read Ming's paper 5, 6, 7 times before it was published, I still didn't know what it is. He's shaking his head yes. You know, as far as I'm concerned, it could have been in Chinese and I would have done just as well. Pat Sharon, digitalis antibody. Where's Pat? Oh, there it is. Digitalis antibody. When's the last time one of you fellas ever used digitalis antibody? Nobody, but we used an awful lot of dig in those days. And we made a lot of kids ditch toxic. And we were the only ones south of Philadelphia, I believe, who had digitalis antibody, and we cured digital toxicity within minutes. She's the first one to ever report it. Mia Fani is not here. First one to report uses Sotolo, propafenone. All these drugs that you're using today in the immature animal, etc. Annie, pethanidine. You remember those days? Same thing with pethanidine. Jay. You may not know this, but Jay, after he went through his fellowship, he was hired. He went to the lab. Calcium fluxes. Nobody ever mentions that anymore. The pulmonary artery, first one ever to look at the pulmonary artery as part of the cardiac system and measuring fluxes. And then hopefully it was gone. But as we also listened to our faculty, and why we surrounded ourselves with smarter people, was that Jay said after a while, I can't do this anymore. What do you want to do, Jay? I want to go to Boston and learn something about pushing coils around and closing things and opening things. I said, sure, go ahead. You know, he did. He came back, and what year? Even though Dr. Tamer did the first balloon of the pulmonary valve after Gene Kahn presented it back in the early 80s, that's as far as we really went until Jay came back and started a true interventional program that moved along. And I was smart enough to take a phone call from Taiwan one day. Who is it? Hey, what do you want, babe? I want to come home. Come on home. Again, your ideas, ex-fellow's ideas. It was the smartest thing that, as far as I'm concerned, the smartest thing he ever thought of was coming back and joining us and developing a true program in cardiac electrophysiology. Again, the first one. Matty Moss here. Matty Moss really was one of the world's experts on vasoactive peptides. Nobody knows what those are anymore. Who knows? What fellow knows what a vasoactive peptide is? 4 papers in 18 months, Circulation, Journal of Physiology, of vasoactive peptides on the effect of the heart. I mean, all these things were what you gave our program and made it what it is, as Arthur described. Now, we come to the hard part. I was up till about 1:45 last night after leaving Jay's house. And what I can't find the words, I can't verbalize well what the program went to, what we meant to you and what you people meant to us. So I thought I'd use some examples about this relationship. As I look around the room, I had the pleasure of being the best man at one of your weddings. I'm not talking, you know. I remember being invited to many other weddings. I remember the birth of your children, but most of them were born in Jackson. Maddie holds that record, by the way. I never knew she was normal, you know. I'm not going there, Sharon. No. Maddie's mother, Maddie lived about 10 blocks from me. And I used to go there, play with her kids, talk to her mother. And the relationship that we had is that when her father died, her mother took the father's watch and gave it to me. Because of, quote, how I helped Maddie in doing other things. I still have that watch to this day. Sharon Kaminer. We've had a few significant tragedies in our department on both sides of the fellowship, as well as the faculty. And one of our faculty members' family needed blood. Sharon said, I'm not giving blood. She never gave blood. I would stick a big needle in her arm, but she went right down, and I think of the 6 units we needed, 5 were given by fellows. You know, that doesn't happen in those programs that Arthur said. When I was having surgery, the last person to come see me the night before surgery was Eloina and Otto. I mean, I had my tonsils out. A little bit more than that. Otto said, I want you to have this. Took off his St. Christopher's medal, gave it to me. I want it back, but you keep it until you're ready to go home. Yeah. Grace was my mother's superior. As I said, if I stepped out of line, she'd tap me on the shoulder. I think she's still doing it. In fact, more now than ever. Tala, stand up, Tala. It was not just faculty and fellows. Tala worked with our department for many, many years after she worked in the ICU. You can sit down now. Everyone saw your blonde hair. You had Bruce Brown was our first patient who ever had a transplant. Typical Afro-American from the inner city, never took his meds, rejection, hospitalization meds, etc. Tyler came to me and said, "We got to do something." I said, "What do you want to do?" "Give him a job." We gave him a job in our department. After school, Tyler gave him his 3 o'clock meds, didn't send him home till Tyler went home, got his 6 o'clock meds. Tyler got it. And one of our families needed hospice care. Tyler sold everything that person needed from the hospital, went an hour out of her way to drop it off. That's what we were all about. I can go on and on and on. I guess I should end up by saying, Perriman, not a fellow, but our relationship also with surgeons was very tight, as Arthur said. 2 things. I have to say it, Sharon, I'm sorry. Perriman's birthday party, which I went to. What are you laughing, Cass? Do you remember that one too? It was in the Grove at one of his hippie friends, the older guy. Enough said, right, Cass? That's the other. The other one's even better. He used to live at Quayside, right down the block, or right up the block. And I used to date a lady from Quayside. And I walk up one day to go there. He's in her room, in her apartment. Wait a minute. She's got her tuchus exposed. Put the linguist here, tuchus's rear end. They're giving her a shot in a bad tuchus. I said, Perriman, you can't. It's true? True. Anyway, I know I took long, but this was a very tough thing for me to say and do, be very honest. The only thing that was ever tougher was saying a eulogy at Debbie Crisell's funeral, who was an old patient of mine. All I can say is thank you again, and this is the best Super Bowl weekend I've ever had, and ever will have. I love you all. Thank you.
Now it's time for the commercial. And really, can you key up those few slides? I don't know how Arthur stole my slides. But what I was thinking is that a reunion is a time for remembering. And in addition to remembering your immediate teachers, it wouldn't hurt to know the history of the pediatric cardiology practice in South Florida. And the truth is that Francisco Hernandez started, can we have the next one? Started the art and science of pediatric cardiology in 1945 in the Rheumatic Fever Home. And then in the university campus where the National Children's Cardiac Hospital was moved. Next one. He came from a small place in the southern shores of Cuba, Cienfuegos. Next. And he was good friends with Agustin Castellanos, who was fearless when it came to injecting contrast materials into the heart. Most people nowadays wouldn't be that fearless, but he made these experiments and got the experience that we still are benefiting from. This is the 1937 Children's Hospital Havana lab, and you see how many people there are for that poor little one baby. Next. This is the lab that they had in the Children's Cardiac Hospital, and you see that it's cut film, Schonander technique. Nobody ever hears about it anymore, but the resource was there for the people of the South Florida area. And this is a gathering in, maybe Eloina knows who these people are. I can see Eloina, third from the right, Hernandez in the middle, Otto to his left, and the rest of the people I don't know. Do you remember them? It goes back a long while.
That was at the international meeting. Helen Taussig was the guest speaker at that meeting.
Well,
She's
there are
next.
different doctor of the National Children's Hospital there.
Okay. Next. This was the, I didn't bring these slides with Helen Taussig, I'm sorry. I had wanted to make this brief. This is the intracardiac electrogram, which was used in those days to enhance the location of the catheter in the heart because the image intensification wasn't that good. But this is the normal intracardiac electrogram, which all of you know. And this is the finding. And Frank Hernandez was very humble in giving credit to the technician at the console who saw this during the cardiac catheterization while Frank was doing the manipulation. And he gave it to, I think it was the American Heart meeting, and it was the first of its kind of report. And next. This was around 1977 when, after Mary Jane had arrived and brought Peter and Heinz and Otto, Jerry Kaiser's on the end, and Hernandez was still there as a mentor and as a guiding spirit. So I don't think we should forget him. Next. Now comes the commercial. After, in 1970, before Frank died, Jerry Kaiser, Gary Schiebler set up a lectureship at the University of Florida. And he had very creative funding mechanisms, but most of it has come from his own pocket. And for years, the money was lost, and the chairman of pediatrics in Gainesville was using it for, I guess, petty cash, whatever. But lately, we've had meetings where the lectures are held in Gainesville one year, in Miami another, and good people are brought down for the experience of the fellows. Next. So send money. This is this fund has a principal amount that's so close to being self-sustaining that with a little help from our friends, we can create this and then go on to another fund for closer to home efforts. How's that? Okay? Thank you. And I have to say, this experience is overwhelming. I never thought that I would have so many friends come back, and I love you all.
I forgot to mention one more thing, and that is when the day started, just to remind you of our relationship, my day wouldn't start when my office was in Mailman until little Georgie Giroux come run down the hall from his, and Darcy wouldn't show with his honcho by the name of DJ. And the first thing he did every morning when before he was dropped off, he'd run down to my office. Him and the two of the little Georgie now. Well, big Georgie's a grandpa. That surprises me right there. But little Georgie, how old is he now? 30? How old?
37.
37 years old. Again, just emphasizing that we were nothing but one big, happy, lovable family.
You have to forgive me, but I'm in the age of senile dementia, so I have to write things I want to tell you. Many of the things I'm going to say, they're already discussed here, but okay, this is my own view of this. It's an exceptional pleasure to have the opportunity to see and speak with all of you tonight. Your presence here is so meaningful and rewarding to all of us who have spent our lives teaching, and we thank you for the opportunity. To begin, I would like to say a few words of tribute to the two very special teachers and mentors that have left us, Dr. Otto Garcia and Dr. Grace Wolf. I first met Otto in 1972, a couple of years after he was discovered working as a neonatologist at Jackson. Previously, he had been an accomplished clinician and pathologist in charge of the cardiac catheterization at the Children's Hospital in Havana. In Miami in 1970, Otto was put in charge of the cath lab at Jackson by Mary Jane Jesse. His creativity in this lab is well known to all of you. One of his creations in the cath lab was Dr. Jay Chandler. Otto had superior knowledge in this field, with a passion for good clinical work, and he was a perfectionist in doing hemodynamics and angiography. Back in Havana, before immigrating to the United States, Dr. Garcia had assembled a unique collection of hearts with congenital heart disease, which he himself had dissected. Otto described the very first case of interruption of the aortic arch, confirmed by a post-mortem examination. Dr. Löw, Dr. Cazul, and later Dr. Tausig traveled to visit Otto's in Havana to see his collection. Nonetheless, Otto was humble, completely genuine, and he was gifted with a quick wit. So it was impossible not to love him and to be captivated by his radiant personality. Oye, chico, or Bobo. Otto left us at 84 years of age, showing us his generosity and greatness of work until the very end. Dr. Eloína Garcia herself, an accomplished pediatrician, and the love of Otto's life has honored us with her presence in this reunion. Eloína. Now a few words regarding Dr. Grace Wolf. I met Grace in 1968 during our first year of fellowship at Boston Children's Hospital. Grace had moved from Marquette University to Columbia to do her pediatric training, and then moved to Harvard for her training in cardiology. In the very competitive atmosphere of Boston Children's Hospital, Grace was an oasis of kindness, graciousness, and peace. After her fellowship at Boston Children's, she practiced in Albany, New York. After that, it was our great good fortune that she was recruited by Mary Jane Jesse to a group in Miami in the late 1970s. In Miami, Grace met her future husband, Armando Perez, who has also honored us with his presence in this event. Grace became an accomplished electrophysiologist. She was one of the editors of the third book, Cardiac Consult on Diagnosis and Management of Arrhythmias in Infants and Children. Grace also became the chairwoman of the board of Pediatric Cardiology. She published several seminal papers in the field. Some of you, including Ming Yang, were her students and contributed to these publications, and have continued the expansion of knowledge in arrhythmias and electrophysiology. Her premature death affected many of us very deeply. Perhaps one of the best sentiments about Grace was expressed by Judy Schachner, our chairwoman in pediatrics at this time. She was an outstanding doctor, teacher, mentor, friend, and above all, a radiant light, often full of laughter, goodness, and great positivity. Grace was well named. Finally, a few words for Dolores Tamer and Henry Gelban, which complete the old guard of our group. I have had the privilege of knowing Dolores for 44 years. Dee was trained in Buffalo at the Children's Hospital in Philadelphia. In 1967, she joined Francisco Hernandez, the preeminent pioneer in pediatric cardiology in the southeastern United States. In 1970, you already heard that, Dolores performed the first balloon atrial septostomy in a neonate with transposition of the great arteries in the state of Florida. Dolores was a superb clinician and was the director of the cardiac clinic for many years. On a personal level, Dee is not only an excellent friend, but she is a person of kindness and outstanding generosity. There are many examples of this, but I will mention just two. When I had just arrived to the University of Miami from Boston in 1972, Dolores and Akram let me use one of their cars. This was an extraordinary kind and generosity and generous gesture, considering they hardly knew me and didn't know how reckless I am to drive. Another example of Dolores' friendship and generosity is the fact that she spent the last days and nights of Grace's life by her side. Now to Henry Gelban. Heinz succeeded Mary Jane Jessie and Sidney Blumenthal as the leader of pediatric cardiology. I've also known Heinz for 44 years. During his long reign in pediatric cardiology, 1976 to 1995, he was always a benevolent boss and, when necessary, a benevolent dictator. He was consistently wise in his decision, and without fail, Heinz was a good and reliable friend, giving advice if needed, and sometimes when it was not needed, and always with a good sense of humor. You know that. Dr. Gelban worked and received a coveted grant from the American Heart Association to study pharmacology, arrhythmias, and electrophysiology. He also had the only NIH grant in electrophysiology for fellows. In 1977, he published a seminal book, Cardiac Arrhythmias in the Neonate, Infant, and Child, followed by a second edition a few years later. Within the specialty, these two books became obligatory reading. Under Heinz's leadership, the fellowship program, which was started in 1975, flourished. Dozens of papers were presented or published, many by you, the fellows of that time. Division morale was always high, and there was genuine fondness and friendship among the members of the old guard. And now El Gordo, a nickname affectionately given by Otto, which we all use, is a handsome and slim senior citizen. Long live the chief. In closing, I would like to thank the organizers, and everybody said that already, and collaborators of this reunion, particularly Ming and Jay. And I want to say a heartfelt thanks to all of you who have joined us tonight in this gathering. It is uplifting to learn what you have done, your lives, both professionally and personally. We see accomplished pediatric cardiologists, teachers, and leaders, many of you parents, perhaps bringing up the next generation of pediatricians and pediatric cardiologists. You have added yet another positive dimension to our lives of teaching. We feel tremendously honored in seeing not only that we have accomplished our mission of passing the torch, and knowing in turn that you too will pass that torch, but in seeing that you, our students, have gone on to become better than your teachers. Few things in life are more rewarding and more gratifying than watching the seeds we have planted become strong trees full of leaves and flowers of life. Thank you all.
Amazing, and basically one more time, just reiterating what has been said the whole night. Our mentors are extraordinary human beings that not only distinguish themselves by their medical knowledge, but also by the kindness and dedication, not only for the care of their patients, but also other trainees. And now a few words by Dr. Jay Chandler.
This is a comment. It was not a plan before, but a few minutes ago it struck me. We are honoring all of you, but there are some people who are fellows as well as faculty, my teacher. And when Arthur told me yesterday he has retired, I felt, Arthur, you should be included in that list, not on our list.
I'm fine, thank you very much.
So the next reunion it'll be a retirement party for Arthur. Like, yes, sir. Arthur, like, we had great words for them. I have great words for you too. You were my attending for 2 years. Probably Liz, Jorge, they'll all agree. Pablo, he's a great teacher. He's one of our mentors. Thank you, Arthur.
Thank you.
Another party, I'm going there too. Well, now the next item in the agenda will be the presentation of some gifts to our mentors. I'm going to be calling to the podium to Dr. Sharon Kaminer, Dr. Irma Pacheco, and Dr. Leonor Cias. Dr. Young, what is next?
Dr. Freya, please.
Pete, they want you. I'm getting a wheelchair, so anything they give me is fine.
They just surprised me because this is really an honor to give you this gift, Dr. Perler. I was maybe the oldest fellow that you have, but so many years I learned too much of Dr. Perler, and I really appreciate your teaching, Dr. Perler, and it's an honor to give you this gift.
Heinz, it is my honor and privilege.
I thought she was going to get nervous.
And this gentleman, I'm sure you all remember, is that your age, IQ, or number of light-skinned parents?
You know, if it's not Viagra or adult diapers, I don't want it. You thought I was going to say, right?
Dr. Tamer, I have the honor of presenting you with this gift, and just thank you so much for all of your education in the cath lab.
I won't be able to the diapers maybe.
Amazing, thank you. Now we're going to be having group pictures because the photographer is about to leave and we need to have those memories for the next reunion.